More than 2 million people in England may have suffered some long-lasting symptoms after having coronavirus, a new study has concluded. Having questioned over 500,000 adults, the REACT-2 research study found that over a third of the people who'd had the virus said they'd had symptoms which lasted for at least 12 weeks. Earlier, I spoke to Professor Paul Elliott of Imperial College, who directs the REACT programme, and I asked him if this is a vastly more prevalent aspect of COVID than we ever knew.
Yes, John, that's correct. What we were looking at was persistence of symptoms beyond 12 weeks, and we found that something like over 5% of the population reported that they had symptoms related to their COVID illness, which persisted for over 3 months.
But do we have any more precise picture of precisely what long COVID really is?
Obviously, this is a new disease, and we're learning as we go. But what we did do was look at the responses from our participants, and we ended up with two major clusters. The first was dominated by tiredness as the main symptom, and that seemed to be very prolonged, well beyond the 3 months. And then the second group was dominated more by respiratory illness, shortness of breath, tightness in the chest pain, and so forth.
And you seem to have found prevalence amongst women and people from deprived areas.
That's correct. There was certainly a higher prevalence among women, and we did see that more disadvantaged people also had a higher prevalence of reporting persistent long-term symptoms.
I mean, is it too early to say that deprivation is a major factor in the whole question of the COVID outbreak?
Certainly, deprivation plays a part in the acute phase of the illness. And what we're seeing now is that we're also seeing that there is potentially more prolonged symptoms of having had the infection in people from poorer areas. And we need to do more work to really understand why that should be.
But the scale of your findings already at this point represent an appalling challenge to the National Health Service.
They do, and clearly and rightly, we've been focused very much on the acute aspects of COVID-19, which have been devastating. Now we're seeing that there are these long-term effects, and we do need to worry about how we're going to deal with that, both from an understanding and research perspective, but also from healthcare perspective. And as you know, the NHS is now setting up these long COVID clinics, and also funding GPs to learn more about the longer term chronic symptoms that people do suffer who've had COVID disease.
To what extent is this unprecedented?
Well, we do know there's so-called post-viral syndrome, and some of the symptoms that people are reporting are quite similar to other post-viral illnesses. But also we know that there are important organ damage that you can get from having had COVID itself. We have an ongoing research program specifically focused on long COVID, where we've been inviting people up to our clinics to do detailed clinical measurements, take blood samples and so forth, which we will now be analysing to try and understand the basis of the disease. And that hopefully can lead to development of better understanding of mechanisms and ultimately new treatments.
Professor Paul Elliott, thank you very much indeed for talking to us. Thank you.
Thank you.